All right, so looking at some of the summary points, really we want to know that knowing the location, the artery, and the time since the onset of your stroke can really indicate areas of possible weakness and really help start to determine your prognosis. The key period in time in which you really want to focus your intervention on for functional recovery is within the first 6 months. And then any time thereafter is really based on neuroplasticity. So what you train is ultimately what you're going to be able to get out from the patient. If you're not seeing any of the functional return that you're hoping to see within the first 5 to 6 months, you should then maybe start considering using some compensation techniques to allow your patients to really continue to gain as much independence as possible. And the most important thing to always remember is to continue to incorporate the involved arm or the leg into everyday tasks. It may not be able to do the job that it was supposed to be doing, but just incorporating the arm or the leg into the task is allowing that neural circuits to be activated and hopefully starting the process of getting it back to being able to function the way it used to. Remember, if you don't use it, you will lose it. And the area within your brain that it really is focused on the arm or the leg starts to recede if it's not used. The good news is, obviously, is that if you start to incorporate it within the first 3 to 6 months or much later, 6 months post, you are able to regain the territory that you once lost and hopefully regain some of the function that you've lost as well. But ultimately, it's not going to be the same as what it was once before, given that you haven't used the circuits as much as you could. So use it, don't lose it.